Good day, everyone. I am John, your moderator for this webinar. I welcome everyone for today's webinar, which is called Dissecting the latest OIG audit target. So now, I would like to introduce our presenter for today. She is my favorite speaker. So her name is Tony L. Holmes. Tony L. Holmes, CCS, CPC, CPMA, CRC, AHIMA approved ICD-10 CM and PCS trainer in an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, and revenue cycle management. She is the founder and CEO of Alpha Coding Expert LLC. So now I would like to hand over the floor back to our speaker. Over to you, Tony.
Thank you so much for that warm introduction, and thank you to all of our attendees today. I really appreciate your time. This is one of my favorite topics to present. So we're going to be talking about who are the players, who are the governing authorities involved in not only overseeing healthcare compliance, but also enforcing it. We're also going to talk about the various pathways that can be taken in a compliance audit investigation and how that all works as far as where it starts, who you would hear from, the type of correspondence you might receive if you were to receive any type of additional documentation request, how to handle that versus a true compliance audit versus a investigation. So we'll talk a bit about those different pathways. We're also going to talk about the OIG Work Plan. So it is a very important resource that everyone needs to be plugged into, and it is regularly updated. We're also going to be talking about some of the most current trends in auditing compliance, and we're going to talk about some of the audit targets from the payer's perspective. We're going to talk about it from the OIG perspective. Then we're going to dive into specifically what are some of the audit targets for fee-for-service, where providers are billing for services as they're rendering them, versus audit targets for risk adjustment, payment methodologies and models. So two different types of reimbursement, two different types of methodologies. So we're going to talk about the audit targets for both of those areas right now. We're going to also talk about the key elements of an effective compliance plan, and that is going to be based on the OIG's framework. We'll talk about the two different pathways you would want to explore if you find yourself in an instance where you may need to self-report. We're also going to talk about where to find OIG advisory opinions, what those are, and how they might be useful to you as you are exploring different areas of compliance in your organization. So let's jump right in. Compliance, the atmosphere, the landscape has changed significantly. In the last 5 years, I would say it has drastically changed. We went from the audit targets really being focused on the high dollar services, the DRGs, the inpatient, services that are very expensive, high DRG length of stays that are targeted, to now everything being targeted from evaluation and management services to minor procedures to modifiers to all of the things that have happened in the last almost 3 years with the pandemic and how things have changed with telehealth and COVID-19. All of those services have now become prime targets. So fraud, waste, and abuse is a term of art in the industry. It's something that we hear all the time. So these terms are very specific in their applications, but they're also kind of an umbrella term for all of the governing authorities that we're going to talk about safeguarding the government's trust fund. So causes of improper payment. So data analytics. Data analytics is huge. It's something that basically leveraging technology to see data in a very sophisticated way, to be able to trend data, to be able to track data, to mine it. And it is so much more extensive and expansive than it was even just a couple of years ago. It's changed a lot. So who are the players? There's like tons of acronyms. It's hard to keep everything straight. So MACs. So MACs are basically working on behalf of the Centers for Medicare and Medicaid Services. So they're the contractors. So when CMS puts out a policy or puts something on their radar, they are very much in alignment with CMS. DPICS program, safety contractors and MITs. So this is the map that used to be. So this is the map where the contractors for the ZPIGs and the MITs and the PSCs were working. Again, there's still some legacy projects that are taking place, but those have pretty much phased out and are now the UPIC. So the UPIC are the basically the umbrella for all of the previous initiatives where they were contracting through the ZPIGs and the MIT. So then we have the Office of Inspector General. So the OIG is a huge organization. It's not just what we do in healthcare. They oversee many different departments. Then you've got the Department of Justice. So as you can see, the Department of Justice has lots of umbrellas within the Department of Justice. And as you can see, the Office of Inspector General is under this umbrella. So just again to remind you, everybody is coordinated and working together using a uniform case management system, so it's very integrated. CIAs are a really big thing. So the OIG, depending on the pathway that the investigation takes, can decide to negotiate with a provider or a health system or any type of entity. It's basically a settlement agreement to comply with ongoing investigations, to do things like really get your affairs in order so that you're not excluded from federal healthcare programs. So the work plan. This is an incredible list of initiatives that the OIG and its many different departments, and you'll see the OAS, the OEI, are basically going to undertake in the coming year or the coming years. And they publish that information. So you can go on their website, you can see their updates. So as early as July of 2022, they've released update to their work plan. So much going on with telehealth and COVID, telehealth services in federal healthcare programs. Spinal pain management services is another one. They're going to look at pain management injections, trigger point injections, lumbar epidural steroid injections to make sure that they are billed and paid appropriately. So some current trends for fee-for-service. We'll talk about the effective ingredients of a compliance program. So the OIG put this out, and it is really a foundational element that you need to have in your compliance program. Yes, thank you for your time and attention. I really appreciate it. I hope that you've taken lots from this webinar, and if you think of something and you have a question in the future, reach out and we'll be happy to take care of you. I hope you have an awesome rest of your day.